Welcome to Encouraging Wellness, where we shed light on the plethora of holistic healing and wellness methods so you can give yourself the power to ask why and become bigger than the condition you are dealing with or the illness you are currently fighting. Join Pamela Worth as she sits down with doctors, medical experts, healthcare practitioners, and those with unique healing stories to dissect groundbreaking practices that combine traditional Western medicine with alternative modalities. Hear conversations that empower you to go beyond hurtful stigmas, outdated practices, and unnecessary labels, guiding you towards a healthier and happier you. Here, we highlight your true worth and help unleash your inner courage. Now your host, Pamela.
Hi, this is Pamela with Hello Health and the Encouraging Wellness Podcast. And today I have Dr. Cindy Howard of the Innovative Wellness Center. Thank you, Dr. Howard, for being here.
Oh, it's so great to have you here. Do you see, I'm hosting the podcast. It is so fantastic to be here. That's what happens after a long day of treating patients, right?
Yeah, so tell us a little bit about where you are, what you're doing, certifications. I mean, medicine is certainly evolving, and so we'd love to hear a little bit more about what you're doing.
Yeah, great. Thanks. It's interesting. So my background, about 25 years ago, I completed chiropractic school and decided I wanted to be a little more broad-based and all-encompassing. So I went through a lot more education and got what we call a diplomate in internal medicine and nutrition. And as a result of that, I've run a very broad-based practice. And the way I describe it is anything you would have gone to see your general practitioner for, we do here at Innovative, except we don't do any prescription meds, we don't do any surgery, and Illinois will not allow us to deliver babies. So those three things are off the table. Everything else is pretty much fair game, and that's how we practice.
So you mentioned Illinois. Where are you in Illinois?
So I'm in the southwest suburbs, Orland Park. So we're about 25 miles out of Chicago. I'm licensed here in Illinois. I'm also licensed and practice occasionally in Florida as well.
Okay, well, especially during winter, right?
Yeah, although, that humidity out there is just enough to send me back, even sometimes in the cooler months.
Well, good. So when you went back, I think this is kind of interesting too. So as a chiropractor, when you went back for additional education, how much time did you have to commit then doing the secondary?
Yeah, it's interesting. So the diplomate programs encompass about 300 plus hours a piece. So it's a weekend course, right? So once you're done with school, you don't have to go back full time. What's really interesting in the chiropractic realm is a lot of what we learn in the diplomate program gives us additional education, but depending on the school we graduate from, a lot of it we get at a very basic level at some of the chiropractic colleges too. So the scope of practice allows for the way we practice with or without the letters, which is very interesting. The letters just give us a little more credibility, a lot more education, camaraderie within the team, and a network of doctors that really, take the work that we do to kind of a next level to make sure that patients are really getting the right care.
Excellent. And so, in terms of what you're seeing and doing right now, where are you seeing a lot of patients, and what age ranges, and what do you find is going on right now?
Yeah, it's interesting. I treat all ages. I see from, the minute they pop out, if mom and dad will bring them to, elderly, with the majority of people really probably being between 20 and 60, which is still a very broad group, obviously. It's really been interesting because I think, especially in my community, medicine has really taken a pretty significant shift. It's become very corporate. A lot of the small mom and pop offices have been bought out by larger corporations that are being dictated to in terms of, this is how we elicit care. These are the only treatments, and you follow a textbook protocol type model. In a lot of patients, which is why I think we're getting a broad base of ages, they're really looking for something different. Almost like that old GP, back in the day, probably way before you and I were born, of, when the GP used to visit the house and it was very individualized medicine, and you actually talked to the patient, learned what was going on, and figured out how to best take care of them. I find that the trend is really moving back toward that, although we don't make house calls. We still provide that type of individualized care that you just don't get in the corporate medicine world, I don't believe anymore.
No, that's cool. And so when folks are coming to you, do you have sort of a questionnaire or a protocol you start with, or what does that look like, so that folks can kind of understand what this looks like, that things that they could start to think about as they're trying to get their hands around their own health and wellness?
Yeah, so it's actually kind of fun and interesting because when we talk to a potential new patient, the first initial questions are, what are you coming in for? And we always want like the top 3 concerns that a patient might present with. And then we have a whole questionnaire that looks at different systems in the body that a lot of times will point the patients in directions they didn't even know they needed to go, and realize that maybe there's some things that are common but not normal. And you'll hear me say that a lot. Whenever people have symptoms, it's their body's way of telling them something is wrong. And, they'll choke that thing up to like, oh, well, of course I have PMS. All my friends have PMS. Or, I have hot flashes. And of course we have hot flashes. That's part of menopause. Or, I'm exhausted, but I have, 6 kids. So of course I'm supposed to be exhausted. And the reality is none of that's true. It's just that a lot of these symptoms become common versus normal. And normal is you have no symptoms at all. And there's really no reason to see me, although there's a caveat to that. But so the questionnaire helps guide us in 2 ways. One, for the patient to realize there actually might be more issues. And for me to know really what direction to also take them. Because let's say a patient just comes in with generalized fatigue. There's, 20, 30, 40 different reasons you could be tired. And you certainly aren't going to address every single reason all up front. So if I can be very specific to that individual's needs, it gets us to that answer, that underlying cause, a whole lot faster, which is great for the patient.
Yeah, no, for sure. What do you do with fatigue? I mean, or menopause? Or, I mean, does it all really come back to needing additional things to help your body calm down at night, or is it inflammation? Or, I mean, I've certainly got a lot of friends that this is a hot topic right now. Both of those for sure.
Yeah, so I think you kind of asked 2 separate questions that play a role. And although fatigue is part of hormonal changes, whenever there's symptoms, something's wrong, right? And we get brushed under the rug a lot, or we just get that prescription, right? Here, take this, hope that helps, see you in a few months if it doesn't call me. And it's really about figuring out where patients are broken. So let's take the hormone route for a second. We think about the main hormones, estrogen, progesterone, testosterone. And let's say we're deficient, or we don't have good relationships of those 2, and then we just get on one of those, right? Whether it's prescription or natural. But what a lot of people don't realize is there's underlying reasons those hormones may not be balanced. For example, if the adrenals aren't working well and we're low on DHEA, that helps us produce estrogen and testosterone. That might be the piece we're broken. Mm-hmm. We might have an underlying thyroid condition that wasn't worked up appropriately by a doctor because they didn't run all of the thyroid numbers, all of the different components of thyroid. And the thyroid might be affecting the adrenals that affect the hormones. And yet maybe the pituitary isn't really happy, and that's why the thyroid isn't working well. And maybe it's really about nutrients, and we're not getting the proper nutrients. We're deficient in iodine or selenium or B vitamins, and that's starting the cascade that then eventually leads us to the hormone disruption. So it's almost like peeling back a layer of an onion, right? Sometimes it's as simple as that outer layer. You just need a little extra progesterone. And sometimes it's really getting to that core of the onion as to what the cascade was that started that effect that gave you that symptom. So it's oddly complicated, and yet sometimes can be really simple if you just know where to look.
So do you find that you have to start with a blood test, or are there other ways to kind of go about this? Because sometimes those are painful and expensive. And
yeah, they can be. And I think there's lots of approaches. I mean, I'm definitely a lab girl. I love blood work. I love saliva testing. We use urine metabolite testing, especially in hormones as well. Fatigue is funny because it could be hormone, it could be cardiovascular, it could be a urinary tract infection you didn't even know you had. It could be as simple as you're not sleeping well or you're over consuming caffeine. So the testing helps me to confirm what I think, which is really important, because as much as I always think I'm right, I'm wrong a couple times a year. So I want to confirm what I think. It also tells me how far off you are, right? So even if I assume, let's say you need something, do you really need more than I think, which could inhibit you from getting well because I don't dose appropriately. So the testing is important. However, you're absolutely correct. There's always a price tag to everything, and money is always, a discussion, right? Because we have to decide what's a priority and where we spend our money. So we're very careful about working within patients' budgets. And at the same time, there's a lot of things that we can do off of the questionnaires, a really good history, a really good physical, to make recommendations too, without the tests. And as much as I'll always tell you I love them and I'm going to encourage them, that doesn't necessarily mean, that you can't be helped.
Yeah, it's always been on my wish list. I mean, I'm a numbers and a data geek myself, and I just I wish there was more I could do in the privacy of my own home with like a saliva test or a urine test. happen to believe that the science is there, and I hope that solutions like this come to fruition sooner rather than later. But
Yeah, I think we're working on some really great solutions. I mean, there's a lot of home tests too. I think some of the difficulty with that is one, the average person doesn't know the quality of the test, right? And not all tests are created equal in terms of how they're run or exactly what is run, even though it falls under this umbrella topic, right? And then the second problem is these companies really don't have the ability, nor should they, or can they, to treat, right? So you get all this information, which is awesome, but if you don't really know what to do with it in the right way, it's just information that, sits on a piece of paper. So having the right practitioner who can help guide you to the right testing if you choose to do it, and then how to really interpret it, I think is important. Because the other thing is even if you can get an interpretation, you got to know what's going on with the individual person, right? Because if I looked at 4 lab tests and got the exact same results, it doesn't mean I would treat the exact same way, because it depends what that patient is actually experiencing and what we're trying to accomplish.
yeah, how would you, this is certainly a big topic too of folks that I'm, chatting with. How would you approach something like depression, anxiety, ADD, and it can be anywhere from kids to teenagers to adults. I mean, I think we're all feeling pressured. And so how would you kind of hit something like that?
Yeah, it's unfortunate. It walks through the office way too often now, especially after the last couple of years. I always start those conversations with something that I think is really important. And that is, I always look at the person sitting across the table from me and I say, you know what? All of the things that you just shared with me are not your fault. And I think that's a really important way to start, because I don't believe that anybody wakes up wanting to not pay attention in class or feeling sad or, anxious because they have to go do something. I think that we still have to be responsible for our behavior, but sometimes we can't always control what gets exhibited, right? So that's number one. 2, it really does come down to the physiology and the chemistry of the body. So not only the brain, but the gut and the immune system. And like almost any topic you can throw at me, it comes back to, again, what broke in the body, right? Like what's not working correctly? Where are we missing the puzzle piece? Where does the puzzle piece not fit? All of those analogies of when we can really figure that out, the label of anxiety, depression, ADD, pick one, now all of a sudden goes away because we know what caused the label in the first place. And unfortunately, sometimes there's lots of causes, it's not always just one direction. So like, for example, let's say we talk about gut health and we look at the microbiome and we balance the good bacteria and we look at digestion and absorption and inflammation. And we think, okay, that should have a really good balance and work its way back up to that gut brain chemistry. We also could have deficiencies in the brain chemicals we're producing, or we could be eating something that's causing what we call excitotoxicity in the brain that gets us all wired and, anxious. And it's all those little connections that make just such a huge difference that if we fix them, problem solved, right? And we all feel great.
Yeah, no, for sure. When I was in college, I felt down and I felt, just not on top of it. And so I went to the student health center and they said I wasn't producing enough serotonin. And so then they put me on Prozac, and it took me well over 20 years to get off of it, because every time I tried to get off of it, it just made me crazy. But what I since found out is that I feel similarly crazy when I eat too much pizza or I drink too much beer. And so I think there's probably something related to the fact that my gut does not like it when I take in high amounts of wheat, which makes me feel crazy. And that probably would have been a better discussion to have as a freshman in college when I was eating a lot of beer and pizza. So it's all kind of interesting.
Yeah. I've always said that if we ate well, probably about 80% of my practice would go away, truly. So, bad food is really good for business. And I think it's getting worse, right? With all the genetically modified foods, with all the lack of information about what we're putting in our mouth, the chemicals, the additives, right?
Yeah.
We just sometimes don't know. And a lot of people out there just don't really even know, what healthy is. It's funny. I had a young boy who came to see me years ago, and we always go over diet. And when a patient says to me, I eat healthy, I never believe them. I always I'm like, okay, tell me what you eat, and then we'll decide if it was healthy or not. And the mom relates the story how he's pretty picky. So for lunch, he's got to choose between hot dogs and pizza puffs. So she gives him the pizza puff because it's the healthier choice. And I'm thinking, okay, maybe she's rationalizing the tomato sauce. And I'm trying to figure out how that's healthy, right? And I looked her straight in the face and I said, will you just give the kid a hot dog? At least he has some choices, like, because at that point, it really didn't matter. The pizza puff and the hot dog still weren't going to give him the nutrients that he needed. And it's just that example of where she actually thought the pizza puff was a much healthier choice that got me thinking that we truly just don't know, right? Like most people walk through life not understanding what healthy choices are.
Yeah.
And that education is essential, and food inflames us.
Yeah.
It just does. So, your example is a perfect one. And wheat's a huge, wheat, dairy, sugar, corn. I mean, there's the whole laundry list. And then there's some obscure ones like, blueberries and almonds and things we'd never tell people not to eat that still can be inflammatory. But, what a simple thing to have solved for you if we just cleaned up the diet early.
Yeah.
And prevented 20 years of a prescription med that probably depleted a whole lot of other nutrients and caused some other issues.
Yeah.
It's very
yeah. So, with families walking in the door, is there anything that you're kind of like, hey, don't forget to, you always like doing a probiotic or an omega or a multivitamin, or what do you like or dislike? And what do you think about gummies that are out there that seem to be all the rage? And
yeah. Yeah, it's interesting. So if I do nothing else, like I think a multivitamin is a really great idea, understanding that it's not therapeutic, right? It fills in little gaps. If you're really low in something, we're going to have to do something extra, right? So that's number one. Love a probiotic, but at the same time, it's interesting because everybody's, it seems like, is on a probiotic now, right? But you have to really look at the strains that are in a product, and you've got to see the quality of the strains. And yes, we can actually get too much good bacteria as well, causing issues like small intestinal bacterial overgrowth and other symptoms. But I do love the probiotic. I do love the fish oil. It's great for heart health, skin, brain health. One of the things that I always look at that way too is the quality and what's in the fish oil. A lot of fish oils can actually go from being anti-inflammatory to pro-inflammatory over a period of time. And again, kind of a dirty little secret in the nutrition industry that not everybody knows. So a lot of bad quality fish oils.
And back to the presence of DHEA, is that correct? Or
well, no. So DHEA is your adrenal hormone, right? So you're looking at EPA and DHA, and then you want just a little bit of GLA with it, either in your product or as a secondary product, to keep that as an antioxidant, as an anti-inflammatory, rather than becoming pro-inflammatory or pro-inflammatory, I should say that the right way.
How does someone find a GLA? Do you have any brands that you really like that really provide that GLA in the omegas, or is there also a vegan one? I think a lot of folks are kind of asking a lot of questions now about where to find decent products.
Yeah, it's so hard. I mean, my recommendation usually is to do a little bit of borage oil. So if you're taking a fish oil and you just need that little extra, you just pick up a borage oil as a separate product, from your favorite manufacturer. That's a really great way to do it. And then, the other nice thing to help from an absorption standpoint, which is my fourth thing, if somebody comes in, is vitamin D. That helps because they're both fat soluble. So when you take the D with the fish oil with a fat in your diet, the absorption rate is going to be better too. So that can help increase. Yeah.
And I love that. Now, with my own kids, when I was going through this, the doctor was very specific that it should be a vitamin D3 and not just a vitamin D. Do you have an opinion on this, or?
Correct. Yeah. You want the active form of D. So yeah, definitely D3. And occasion we want that with K, vitamin K as well. And again, typically we test if somebody's deficient, we throw in more K. If they're adequate, we don't. But yeah, definitely D3. A lot of these patients get thrown on that 50,000 IU of D2 once a week, and it doesn't change their active, bioavailable D. And it also doesn't keep them steady throughout the week either. So I'm really a big fan of daily recommended, IUs, and that can range based on levels, but, we got to make sure we're getting the right form.
Yeah. And then I would imagine, I've chatted with a lot of doctors now that are struggling because they want to treat patients the way they want to treat them, but they can't get things through the insurance company. And so now they're, turning to things like subscription pay or cash pay. Or do you have any thoughts or opinions on any of this when folks are trying to find, and do you do a search in Google for like an integrative health or a functional health, or what do you do if you're listening and you're kind of like, okay, so now what?
Yeah, you know what? I went cash almost 15 years ago. The insurance companies were actually putting me out of business. I'll share with you an interesting story to make my point. And a lot of insurance is based on Medicare reimbursement. Medicare will not cover a vitamin D test unless you're vitamin D deficient.
And how do you know if you're vitamin D deficient?
Right. So we guess and we lie on the form, right? Saying a patient, right? We can't do that as practitioners. And then, it's interesting because even if we're not deficient now, it doesn't mean we're not deficient a year later. So, I think unfortunately, most of the time, there are still some great practitioners out there doing insurance work, but most of the time, when you're in a cash-based practice, the beauty is the only person that I need to answer to is my patient. And if my patient is on board, they trust me, they want something, we get it done, versus me having to justify to an insurance company or, and I hate to say this out loud, right, but talking them out of something knowing that I'm not going to get paid for it. It's just not a great way to practice, right? So I sit in that room and whatever you need and we decide together, we do. So I do think the cash, unfortunately, is if you really want integration, if you really want functional medicine, if you really want individualized care, you're going to have to search out probably a practitioner that is cash based. In my world, and again, there's a lot of great practitioners in different aspects of medicine, but in the chiropractic realm, we always recommend to another DAPC, which are the letters that stand for Diplomate of the American Board of Chiropractic Internists. And we're trained that way to do all of these different types of things. So we're a little selfish. We like to refer within our own profession. And again, I'm not knocking any other. We've got some great practitioners, even in our own neighborhood, that don't have DC behind their name that, we love and we co-treat with. But I think cash is, I think it's the direction things are moving if you really want what you want.
And then do you serve folks on like a subscription model where it's like, look, I trust you and I know I'm going to have to do this, but constantly, paying to show up, is there a way to kind of pay like an annual fee, or do you find there's solutions around that, or is that still too hard to build together?
No, it's interesting. There's a lot of practitioners that do that very successfully. I'm not one of them. I've always been a fan and of just, you get what you pay for, and I've struggled with, and there's two sides of that, right? Like if you do a subscription, there's probably a little bit more adherence. You've prepaid for it. Maybe you'll use it. But I also think there's a lot of patients then that pay for stuff that they never get. And I'm not comfortable taking money for a service I didn't really actually provide, right? Even though the rules of the subscription. So I've always just done where we sit down, we uncover the need of the patient, we meet the need. We lay out a plan, not that there isn't a plan, right? But what you come in for, you pay for, and we just work that way, because sometimes I find that, patients need more or less too, depending on what they need. And to me, those subscriptions, and this is just a personal opinion, just feel a little bit more one size fits all.
Yeah. Yeah, no, I just
really tailoring to the individual.
Yeah, no, it's great. It's interesting. I'm starting to see all kinds of different solutions. And so I think it's neat for folks to be able to kind of hear it from you directly.
Yeah, I think it really does come down to, that's the way I'm comfortable practicing. But if a patient also prefers that, then I'm not the right practice, right? And that's okay too. And that's the beauty of having different models out there, is if they really want that access through a subscription, then, we've got to find them the right doctor to do that.
Yeah, I know from your standpoint too, when folks come in, do you find that there's kind of a typical time frame to start seeing some initial results? Because for me personally, the doctor had told me, look, it's going to take a year to get things straight.
Yep.
And I was like, a year? For us, we saw some really small incremental changes within, 6 to 12 weeks. But it really was a year before it was like, okay, we're good. And I'm not trying to lead the conversation except to just ask, do you find that there's certain things that have shorter time frames to recovery versus longer? Or
I do, but it's so funny because like there are patients that I think are a massive project, and they walk back in my office 6 weeks later like perfect, and I'm surprised, even after all these years of practice. And then I have patients that I honestly think are going to walk back in 6 weeks later feeling amazing, and they're like, okay, nothing is working, I'm worse. So it's like I can answer that question both ways. Now in terms of what I tell patients, 6 weeks is kind of that magic number that we learn, like in the herbal vitamin world, because we give things about that time where I expect to see something, right? So if I put you on a protocol, you come back in 6 weeks later and nothing is working, either A, you didn't do what I told you to do, B, I picked the wrong products and it's just not working for you, or C, we're missing something that we really, need to look further. But if you're 10, 20, 30% better and you keep riding that wave, right? Then we keep going. And sometimes, yeah, it does. My joke is if it took you 45 years to get here, you got to give me a little bit more than 3 days to get you out. right? And we don't need 45 to reverse it. But yeah, I mean, some patients we do work with for a year, 2, 3, depending on the severity. And it also depends on if we really find the underlying cause, because if we find that super quick, if we're still kind of digging and looking because it's hiding, sometimes it takes a little bit longer. So
Yeah.
it's not a great answer. I'd love to tell everybody, give me your best 6 weeks and, we're going to get you 80 to 100% better. But unfortunately, it just doesn't work that way.
Yeah. And then, a lot of folks, are pretty clued into saying that they have certain food allergies. And like I know in our own family, we've done the back scratch, we've done the blood work, and sometimes they overlap, sometimes they don't. Do you find that when you're treating folks that you like one versus the other, or do you do both and then just kind of see what overlaps? Or it's been kind of wild to see all this.
Yeah. So foods are very interesting to me. I've been doing them for a long time. And I think, and it's interesting as I listen to you talk, we use the words interchangeably, sometimes incorrect. So there's food allergy, there's food sensitivity, and there's food intolerance, right? Mm-hmm. So food intolerance is like a lactose intolerance. We don't have lactase, which is an enzyme to break down the lactose. Big bowl of ice cream, diarrhea 10 minutes later, okay? Then we have the true allergy, which, yes, is the scratch testing. And I would tell you, I still think that's the gold standard. Even though we do have blood tests, I still think that the scratch is just a step above, and absolutely refer out to that. Now, in my practice, we don't do that. We would send to an allergist to do that. The food sensitivity testing is much harder, more complicated, and unfortunately all over the industry, right? Where people have access to, I think, some good and some poor information. So a sensitivity is going to affect you from the moment you eat the food up until about 72 hours later. Food sensitivities can run on different antibody pathways, what's known as an IgG, which is the most commonly run. Those are those $99 tests that are out there. Yeah. IgA, which is a smaller percentage. Sometimes IgM, cell-mediated immunity. And then there's also a way to test what's called a food zoomer, which is really new technology, where we take a food and we break it down to its polypeptide protein. So for example, let's take dairy. If we consume dairy, cow's milk, as a whole protein, a lot of us don't react to it as a whole protein. But cow's milk gets broken down into casein and whey, and then a lot of little proteins underneath that you've never heard of. And because when you digest milk, you drink it, it doesn't go down as a whole protein, it gets broken up. Sometimes we can have patients that then trip the test, let's say, just on casein or just on whey, and we would miss it as a whole protein. So in the food sensitivity world, it's pretty amazing how we've come pretty far to start looking to get a little bit more specific and more detailed through that digestive process to make sure we don't miss anything on patients. And it's been really fun because we've picked up on things on some of these food zoomer tests that the other labs are missing. And, where patients think they should get well from eliminating certain foods, they don't always until we, get the full picture. So it's pretty cool to see what's going on that way.
Oh, that's fantastic. Thank you. Is there anything else that I forgot to touch on, or anything that you want to add that, is really an important piece in health and wellness, across any age group? Or
yeah, what I think, if I was going to just give a little bit of, advice to anybody listening, it's, make sure that A, you ask questions, B, you really are comfortable with the provider you pick, right? Like, we might know a lot and we still might not be the right fit for you. And really see, at the end of the day, don't settle. Like, to live with symptoms or to be told, oh, it's just old age, we're getting older, we have to, live with that stuff, or, oh, he or she'll grow out of it when they're 10 years old, just wait a few years and it'll be fine. It makes me sad to learn that people are just kind of told to deal with things. And I guess my advice is, seek out practitioners, as many or as few as you need, to actually hear you and to have that conversation, to understand that there really is an underlying issue, and to offer you some guidance in order to help, get to the bottom of it. Because really, we should, at the end of the day, we should feel fabulous until, we're 102, we lay down, and we just don't wake up because the heart gave out.
Yeah.
That's what I would really hope for everybody listening, is that you seek that out and just don't settle for feeling icky.
No, that's super. Thank you, doctor. And, do you treat folks remotely in case that they can't make it out to Illinois?
Yeah, I do. I mean, that's a tricky thing. It depends how that works. So we do some telehealth. It depends on where you're actually located from the standpoint of what we're capable of doing, because, it comes under licensure. There are some things we can do under like a health coaching type aspect as well, where we can still help, where we're not rendering diagnosis per se and going that doctor route. So it really depends where people are located, what we can offer, but certainly happy to have the conversation and see if we can help. And if we can't, find you a practitioner in your area too. So at least you have somebody local.
That's wonderful. And how do people find you, doctor?
Oh, yeah. Well, the office phone number is 708-479-0020. We're all over Instagram and Facebook too. So you can just pull up, Innovative Health and Wellness Center to find us. We've got a little green man. We call him Wellness Dude. So if you see him, you got the right place. And then the website is innovativehwc.com.
Fantastic. Well, thank you so much for being with us today. We really appreciate it.
Oh, my pleasure. This was great. Thanks.
That's it for this episode of Encouraging Wellness. We hope this serves as an eye-opener to you on new ways to approach your health and wellness. By learning both unique and the best alternative wellness and healing methods, you can live your best life. Listen to more of our episodes at www.hello.health. Be sure to subscribe to the show and leave a rating. Together, let us work towards unlocking you and your family's best self. Thank you for listening. See you on the next one.